So thanks for having me. I've been teaching sexuality here for about 17 years at City College at Antioch, off and on for the past 10 years. I got into this business, well, I studied sociology and psychology at UCLA as an undergrad, and then I got a master's in social work at San Diego State, and then I came back here to UCSB to get a doctorate in education, actually. I worked in special ed for the first half of my career, people with disabilities, mostly children, but then adults with autism and cognitive disabilities, mental retardation, it used to be called. I worked at Devereux when it was a big residential care facility. We had some seniors there as well as from children to older people. And then got into sex ed, actually working at Devereux. In residential care, you have to deal with people's sexual issues, like every aspect of their life. So we had rapes, we had people masturbating in public, and that was just the staff. No, I'm just kidding. Just to see if you're listening. There was a few clients. We did have staff have sex with each other, which was interesting, during work. It's like, no, you should be working. But anyway, I was sort of forced to deal with a lot of issues there. And so I worked with the director at Planned Parenthood, director of education, and she had had some experience working with people with disabilities, so she trained me. I trained our staff. We looked at changing the policies at Devereux because they wouldn't allow adults to have sex, and that's really kind of a client's rights violation if you know the law. So we worked on changing those policies. And then when I left Devereux, I went and took her job and became the education director at Planned Parenthood for 16 years. And I specialized in people with disabilities and sexuality issues. Then I went to the public health department, county public health, and was their education director for 5 years. And then I quit that and just teaching now, and writing a book about my experiences at Planned Parenthood. So, so I have a Facebook page where I post sex-related articles and some videos. And then I have a website, Dr. Scott McCann, you can look at if you want more information. So today we're going to look at sort of defining sexuality first. Look at your own sexual learning experiences and history, because you've got to deal with your own stuff first when you're dealing with people's, well, really anything when you're in a helping role, but especially around sexuality. Because if you're not comfortable, it's going to be hard to make other people comfortable talking about it or dealing with it. So we'll do a little bit of that. We're going to redefine sexuality really as a lifelong process or part of your life all along. Focus in on older adults, what they go through in terms of sexual changes. And then specifically with health and disability and cognitive problems, dementia and so on, that might affect people's behavior. And then what you can do in professional roles to and personal roles to support older adults with their sexual needs and issues. So starting out, so when I say sexuality, what do you think of? Anybody?
Intercourse?
Intercourse, yeah. Sexual activities is certainly a big part of it. What else?
Intimacy?
Yeah, closeness, romantic or intimate relationships, yeah. What are you going to say?
Identity,
well, yeah.
Recently, people, not recently, but it's starting to become more LGBT.
Yeah. So you got gender identity, how you see yourself as male or female. We're living during a great time where transgender people have been able to come out and be accepted more than in the past. And then there's sexual orientation, right? Who you're attracted to. So we'll talk a little bit about those things. So that's certainly big. Those are two big parts, gender and sexual orientation, big parts of your sexuality. Anything else come to mind? Or? Affective intimacy, yeah. Again, love, powerful feelings. So, well, that's great. You've hit a lot of the key areas. This guy, Dennis Daly, did this chart. He calls it holistic sexuality because it includes so much. But you were talking about, like down here, sexual identity, gender roles we all play, sexual orientation, that kind of stuff. Usually sex education focuses on sexual health and reproduction, so sexual behaviors, anatomy and physiology, contraception, STDs, abortion, menopause, sexual dysfunctions, problems that people have. But these other three, you don't really hear much about, especially the top one, sensuality, which is so relevant for working with seniors, because look at the first thing is skin hunger. Do you know, what does that mean? Desire to be touched. Yeah, it's a natural human thing. I mean, babies have it. You really have it throughout your lives. Unfortunately, I think as you get older, you get less and less intimate touch. Not sexual touch, but just loving touch. Babies hopefully get a lot. They need it to develop. Slowly, as kids age, by teenagehood even, they get a lot less of that. Unfortunately, then people just get intimate touch often in the context of sex and not really any other time, unless you come from a real huggy, touching family, and you're lucky in a lot of ways if you do. US isn't super like that. Northern European countries tend not to be. Latin American countries tend to be more huggy and touching in a non-sexual way. But I think of older people who haven't been hugged or touched, if they don't have close relatives nearby or so on, in years maybe. And so it's not sexual, but it's kind of related. And then all the other senses involved besides touch. Body image is a huge thing, especially for younger women who worry about their looks and are taught to be insecure about their looks by companies that make money selling makeup and diet programs and cosmetic surgery and stuff like that. They want you to be insecure. But it ends up with eating disorders and a lot of really serious problems that plague many women, especially, and men too, more and more now, for their whole lives sometimes, or certainly through young adulthood. The other one is intimacy. I think doesn't get enough focus because it's different than sex. Obviously, you can have intimacy without sex. You can have sex without intimacy. But the loving and trust and openness, and to me, there's a key word in here. It's vulnerability. Because I've thought for years, why are people screwed up so much about sex? Especially in the US, actually in a lot of countries. But we have like the highest rates of teen pregnancy, rape, of developed countries, rape and sexual abuse, sexually transmitted infections. We're not really a sexually healthy country that we should be compared to a lot of the European countries, particularly Northern European, Scandinavian countries. We should be in a lot better shape, and we're not. And I thought, why are people so weird about sex? Because it's such a wonderful part of life, really, in many ways. And I think it's about the vulnerability. If you go back and look at wild animals having sex, it lasts a few seconds, right? It's very short and not very intimate. And it's not just because they're animals. I think it's because they're under a threat condition. When you're having sex, you're vulnerable to physical attack. Animals are, right? It's like when they're eating or drinking water. You see them looking around. They don't want to get attacked. And I think with people, there's an element of that, but really it's probably more social risk that somebody's going to judge you or say something mean about your body or the way you act or something. So I think there's an element of vulnerability that is a barrier to intimacy. People are afraid to let down their guard and be themselves and so on. It takes time to build up that trust that leads to intimacy, I think. And then this whole sexualization, we see it all the time in the media. I mean, it includes interpersonal stuff like flirting. It's really applying sex where it doesn't belong. When you're flirting, you don't know if it's a sexual situation or not. You're kind of trying to find out. But obviously, sexual harassment, catcalling, I won't ask every woman to raise their hand and say, how many of you have ever been sexually harassed with men yelling at you in public or in other ways? And certainly rape and incest. But even in advertising, I mean, look at advertising. The Carl's Jr. ads with the woman eating the hamburger dripping all. Who sits around in a bathing suit and eats hamburgers like that, dripping all over? Just models in Carl's Jr. ads, I think. But it's so misleading. And look at porn. I mean, porn is so unrealistic in terms of what most people want in a sexual interaction, especially women. So there's not really good images out there of normal, happy sex. I mean, you can look on the internet, but most of it, again, is porn that's not realistic. So I think for a lot of these reasons, we've got some issues in our country to address. I've broken it down, other people have, into the 3 Ps of sex: the pleasure, the procreation, the ability to create new human beings, and the partnerships. I've been with my wife, we have our 40th anniversary coming up. And people form lifelong partnerships. You don't have to, but many people do, or long-term partnerships. And it's so powerful and meaningful that I've come to the conclusion sex is the most powerful human force on earth. How else can you create new people, for one thing? But just the bonds that people form with love and so on are so powerful. So the question is, how do we develop sexually? Why are you the way you are about sex? What influences your thoughts, feelings, and actions is sort of the domain of psychology. So what do you think?
First is genetics, because people are born the way they are.
Yeah.
And then second is exposure when they go through life. Because based on how you were born from the start, like if you were born gay or straight or maybe trans, when you develop and you see how people interact towards your orientation.
That affects you, of course, how people treat you. Yeah, yeah. So you're right, you really got the 2 big pieces, the body piece, the genetics, the physiology, and then the social world of how people treat you, and you learn from them. Were you going to add something?
Well, yeah, a lot of things. How someone is raised, it's just touching a little more on what she was talking about in the environment. A lot of people, when they are raised in a, abusive childhood and things like that, then obviously they're going to have issues of trust and intimacy. Things like that, and especially I noticed if people don't bond like with their mom, especially if they don't get that love in the beginning, then they really have trust issues. And
yep, yeah, attachment theory, attachment disorders where babies don't get that. Right, it can affect the rest of your life, yeah. So hugely powerful influences, both internally and externally. There's even, the one thing you didn't focus on was, this is my little gingerbread man here, but the physical influences of chemicals in the environment. I mean, we know, for example, that worldwide men's sperm count is going down dramatically. It's almost half what it used to be. And what do you think causes that? Not so much as ingesting chemicals, hormones in the water system from all those birth control pills that get flushed, and let's see, pesticides is probably the leading cause of dropping sperm production, again, in men worldwide. Luckily, men have it's a shotgun method. There's so much sperm when a man ejaculates, they can have half as much and still create pregnancies. But it could, over time, if it keeps going down, be a problem where it interferes with fertility. So, I mean, climate, things like when the missionaries came to Pacific Islands and started telling the natives to put on clothes because they're from Northern Europe where it's freezing, and the people there are used to the 80, 90 degree weather and have learned that it's smart to wear a few clothes if you want to stay cool. But just, I mean, the huge effects like that affect your comfort with nudity or how much clothing you're supposed to wear and stuff like that. So huge impacts from the physical world. The social world, again, in some ways more obvious and powerful. Your parents, your friends, your partners, how movies, I mean, everything around you, how it influences your thoughts about sex and what you think is appropriate or not appropriate. And then again, your anatomy and physiology. The reason I have, and it wasn't intentional to put it on the genital area here, but the reason I have actions, the arrow going back, is because we're not passive actors in the world. We act and we influence things back. We contribute to the consumption of resources, and we influence our friends and our family. So it's not just us receiving, it's us giving back and influencing in a powerful way. So anyway, that's kind of the backdrop for what influences us. I want to focus in on sexual learning history, and we all have this. It's really just looking at the experiences you've had in your life so far that from different sources, like your parents, maybe if you had siblings or cousins or aunts or uncles or grandparents. Friends is usually a big influence around sexuality for people. Partners also. The media, and now there's so many kinds of media, from social media to television and movies and music and just all types that all give different messages about sex. School, how many of you had sex education in school of some type? So most of you, from my point of view, it's terribly limited. The amount of, I figured out one time that the average student, at least in California that I'm familiar with, gets about 10 or 15 hours of sex education in 12 years of education. How many hours did you get on math, English, history? Most of English you use, but math, beyond basic math, do you use all that algebra you learned, or geometry, or trigonometry? I don't, and I took a lot of it, and I enjoyed it, but not practical for most people. So the point being that we need a lot more sex education. Of course, I work in the field, but some schools give more than average, some less. It depends on the teacher is really what it comes down to. And then religious influence, bigger for some people than others, but generally restrictive about sex, kind of clinging to ideas that made sense in the past. It made sense to wait to have sex until you're married. When people got married at 16 and 17, you didn't have to wait very long. Puberty also, here's another not worldwide, but developing world change. Puberty is starting a lot earlier in young women now than it used to. At the turn of the century, it was about 16 when you'd start your period. Now it's about a little under 12. That's a radical change in about 100 years. Does anybody know why that might be? Yeah.
All the estrogen in milk, I'm assuming?
Yeah, so free estrogen, right, in products, right, that they enhance cows, yeah. The other one is actually diet. Women have more body fat now. It's a good thing. In 1900, there were a lot of malnourished people, and when you're underweight, you don't start menstruating as quickly because your body's kind of like knows it's not ready to have a baby. But as you gain weight, and of course now we've swung the other way with the sort of overweight problem crisis, but girls have more body fat, which retains estrogen, so they start their periods earlier. But point being, so if you know puberty started at 16 and you got married at 17, waiting until marriage made a lot of sense. The other thing is that we didn't have effective birth control before, and now we do. And having at least two parents or a bigger family to support child rearing, of course, is a good thing. And again, it probably made sense because sex equaled pregnancy before we had good birth control. Since the development of the pill, really, the hormonal methods in the 60s, now we have good contraception and sex doesn't equal pregnancy. But a lot of the rules in religion still act like it does. Churches are slow, religion's slow to change. Most institutions are slow to change, government things. Anyway, back to your life. Think about like what your parents, and we can break it down. It's not just sexual activity that you get messages about. You get messages about your body, what it's supposed to look like, from all these different sources, probably, or several of them. Gender, how are men supposed to act, how are women supposed to act? Sexual orientation, what, is it cool to be gay or not, or depending on where you live and what people think. Intimate relationships, and really every aspect of sexuality. So I just put a sample, and a lot of parents in the classes I teach, the students say, well, they said wait until marriage, even though their parents didn't wait until they were married to have sex. They know it's not realistic. About less than 10% of people now wait until they're married to have sex in the US. It's not realistic for most people at all. Yet parents keep telling their kids that. Why? Why do they do something that's very unlikely and potentially problematic? Because the effect of that, the important part is, so who's saying it, what are they saying, and how does it affect you? Is you end up feeling guilty, you hide the fact that you're having sex from the people who might be able to help you the most. I always loved it when I'd see mothers bringing their daughters in to Planned Parenthood to get started on birth control before they start having sex, not afterward when they finally get up the nerve to tell their parent that they're having sex. So there's a lot of negative fallout from some of these messages. That some of it's lifelong. A friend of mine, he said his girlfriend cried every time after they had sex. And I said, you must be a terrible lover. And she grew up Catholic Latina in traditional family and thought she was doing something bad every time she had sex because they weren't married. And she had that drilled into her head so much it made it hard for her to enjoy sex now. So we all got positive, negative. Most of us get some of both. From your friends, you probably get more the, good to do it kind of stuff. I don't know, depending on your group. But the important part is to look at your own life. My students in the sexuality class write a paper about looking at all these influences on all aspects of sexuality. What were you told? What was modeled for you? Some of it's not telling. Like my parents didn't really talk to me much about relationships, but I saw them have a great relationship. They were together 60 years until my mom died of Alzheimer's. I saw how to treat another person in a relationship, so they didn't really have to tell me. They modeled it. So some of it's direct messages, some of it's indirect. If your parents never talk to you about sex, that's a message. The message is, we don't talk to our kids about sex. You learn not to do that. And most people, in my experience, wish their parents had talked to them more about sex. And I'm not talking about the one awkward conversation you have at 15, or by then most kids know about sex from other sources, good or bad. But little conversations all along, starting from when you're very little, teaching your kids the names of their body parts, just like every other part of their body. But you ever seen a preschool where they do the head, shoulders, stomach, and then they skip this part and go knees and toes. So there's nothing here to know about. It's like, really? Or they say it's what's covered by your bathing suit, literally. It's like, really? What if you have a one piece? There's a lot covered by bathing suit. But it just shows our culture's sort of schizophrenia about sex. On the one hand, we're obsessed with it and we use it to sell things and in the media. And then on the other hand, we're very nervous and weird about it and don't treat it very normally. So what I'd like you to do is, I'll give you an example because I want you to pair up with somebody near you and just share one early learning experience you can remember. Something said, maybe before you were 10, ideal. I have two, I'll give you real quick. One was when I was 5 years old, I had open heart surgery because I was born with a congenital heart defect. And so I knew nothing about sex. At 5, my parents hadn't said anything. But I was in the hospital in a shared room, and across the aisle from me was a girl who's an older woman, she was 7. We all had the horrible gowns that are open in the back, right, which are made to embarrass patients, I think. They were changing the sheets on her bed, and she had to get off her bed, and she stood on the bed next to it, and I saw through the little gap in her gown her butt. And I thought, that is special. And I was 5 years old. I knew that. This is back to your body thing. It's programmed in for straight guys to like look at women's bodies and go, even girls in this case. I knew nothing about sex. And I just like, I want to see more of that. Unfortunately, and here's the really funny, I didn't remember this for years. My dad, who's 92, just told me like a month ago, he said, the first thing you asked when you came out of your heart surgery, when I was able to talk again and so on, was, is Vicky okay? I was like worried about her, because I want to see her butt again. So that's kind of a biological, not really a learning thing. But the learning thing I remember was my mom telling me about sex. So it was probably a couple years, I was probably 7 or 8. And she said, well, they had taught me body part names all along, so that wasn't new. But she said, so she goes, a baby's made and a sperm comes out of a man's penis. So I knew what penis was. Sperm was kind of, she said, well, this stuff comes out. And I said, okay, stuff. And it goes in a woman's vagina and she has eggs in there and it finds it and it fertilizes the egg. I knew about chickens and, stuff like that. So I fertilized, okay. And then that it would grow in her uterus. She didn't say stomach, which is good, uterus. And I kind of knew what uterus was. And that was it. So, but she left out the intercourse part, right? So she probably thought I knew goes in means literally goes in, but I didn't. So for a year, and I knew you had to sleep together to have a baby, right? So I thought you get in the same bed, the sperm crawls out of the man's penis, climbs in the woman's vagina, and suddenly she's pregnant. So here's the funny thing. I grew up in Chula Vista and just a few miles from the border. And so we were in Tijuana one time. And I saw a card of 2 dogs mating, like a joke card. And I thought, oh, that's how they do it. It's like, well, big revelation. Okay, so that's how I learned about sex. So anyway, pick any source or any message you got or any experience, just something you remember. And the trick, again, is how it affected you. How my mom's thing affected me was like partially knowledgeable and a little off, because she didn't tell me the whole story. But often it's just emotional impacts as well. So pair up with somebody, take 2 minutes to tell your story, and then switch and they tell you their story. Writing down soon. Did everybody get a chance to share? Who wants to? Yeah? Okay. So I just saved you about 10 years of therapy. No, just kidding. Yeah, this stuff stays with you. So again, let's do a little quick practice of just saying some sex-related words, okay? Because again, even when I worked at Planned Parenthood, we go out to lunch and talk about our work, and we kind of whisper. It's like, really? People can't talk about sex in public? And of course you can. We just learn not to. But so let's do some genital names. How about penis? Get a little more enthusiasm. It's a big deal. How about clitoris? Clitoris. Hey, how about, here's the one every girl should learn and doesn't. Vulva. Vulva. Teach your girls vulva. It's not your vagina, that's inside. Vulva's your crotch, outside, right? Because otherwise it's down there. It's this mystery place. I don't know what it is. And actually my students have to do a self-exam and write a paper about their genitals. And of course for the guys it's no easy. They're touching it all the time for some reason or another. Urinating, you know. But women, it's hard to see. It's hard to find. Have you seen your urethra? It's not easy to find. Get a mirror. This is like basic sex therapist training stuff. I know you're not sex therapist, but yeah.
I do have a question
Yeah.
in regards to what you just mentioned. Why do men are constantly like fixing it, or I don't know what they're doing?
Pain, I don't know if you're being twisted or pinched. Scrotum's super sensitive. It's all about protecting your reproductive abilities, right? So at least that's what they tell you. Yeah, let's see, there's masturbation, lots of reasons. But yeah, just comfort probably. Let's see, what's another one? Vagina. Vagina. Scrotum. Okay, let's do some sexual terms. Anybody know what the formal name for sexual intercourse is? Huh?
Copulating?
Copulating is one, yeah, copulate. Coitus, have you heard that one? C-O-I-T-U-S, coitus. So you can impress your friends. Say, hey, let's have coitus. They'll be like, okay. Could be a romantic moment. We won't do all of them. Let's see. So we got to move toward older adult stuff. So again, they call sex negative and sex positive, not just cultures, but people and behavior. Again, the U.S. I don't know if you know, but we've spent $2 billion on telling kids not to have sex. Abstinence-only education, I don't know if you've heard about this, over $2 billion, even though there's research that shows that it doesn't work in preventing teen pregnancy or delaying sexual activity, because our government is influenced by religious beliefs a little bit, I think, even though it's not supposed to be. Yeah.
And also with prospective parents, we had a thing on the news where parents were talking about how they want to encourage their kids to abstain, even though there's science that proved they didn't work. And then they asked like the kids on the other side, like high school kids, saying like, what is actually you want to know? Is like, what's some way to protect myself or blah blah blah.
Right.
And they just don't like want to focus on it because they are stuck with the ideology that kids only want to say.
Right, and that telling them not to will make a difference. I don't even mind that. We did a lot of abstinence training at Planned Parenthood, how to refuse sexual overtures, how to say no, but we also taught about contraception. Because you're right, the research shows that not only are those kids less likely to delay sex, when they have it, they're less prepared. They don't know about contraception. Because the law says you can't mention contraception other than failure rates, which is like discourages you from using it. As part of these abstinence-only programs. So we've got a pretty confused culture again, versus most of the Scandinavian countries. They get sex education in every grade, a little bit at a time, building up in like a natural way. High school students, I have a lot of Swedish students who come here, and they said, yeah, in high school the teacher took us in a van to the local clinic and said, here's where you go before you have sex, get birth control, get condoms, educate yourself. And I've been in schools where they won't even let you show a condom, doing sex education with high school students. That's like, I can't even tell them or show condoms. It's crazy. So yeah, we're kind of sex negative with a little bit of positive. Let's see. So narrowing it down further, what age groups do we typically think of as sexual?
20-year-old.
Yeah, young adults, teenagers, young adults. By 30, too late, give it up. But okay, what group's not sexual? Seniors and children, right? So that's going to fit this thing that sexuality really is lifelong, from birth to death. Even if you're not having sex, it's part of you. It's part of your body. It's part of your brain. And we'll see some data on that with seniors. So how does our culture generally look at sex among seniors?
It's kind of frowned upon.
Yeah, yeah, dirty old men, right? There aren't healthy old men having sex. They're dirty, right? What are women, older women who want to have sex? Cougars, right. They're predators of, right, dangerous old women. Yeah, it's not good. So yeah, I mean, you hit it. What do we got? Sex is for young people. It's a joke or inappropriate. You know, the old couple having sex, haha. I actually show some video of older people having sex in my class, and the students are all think it's going to be gross, and they're actually surprised at how tender and nice it is. I have an 80-year-old couple having sex, and let's see. The good thing is it's changing with the baby boomers getting older, the need for work and service for seniors, just the bigger population. It's becoming more acceptable. People are realizing it's being researched more. But of course, health issues and having a partner available are key factors in whether you're able to have partnered sex, at least. And we've got women living longer, statistically 4 times as many widows as widowers. And how many of you work in a senior care facility or have more women, I'm guessing, especially on the older end? So I had a student who worked in a senior care facility, residential facility, and there was a 100-year-old man living there. And he was actually the healthiest man there. There were few other men, but they were in worse physical shape, and lots of women. So this guy was real popular with the ladies, really. So he had sex. She knew, the staff kind of knew who was hooking up with who. And so this guy kind of sequentially had sex with every interested woman there, okay, over time, not at once. And the funny thing was he gave them a little rhinestone cat pin after they had sex. He must have like a drawer full. So because the ladies would come down to dinner with their little pins on and like sit together and compare notes, I don't know. But no, she said it was like high school where jealousies would form, and it was this whole dynamic thing. But this is my goal, to be giving out rhinestone pins at 100. Yeah, I'll be happy if I get there. Let's see. But obviously people do change as they get older, things that affect their sex functioning. So what are some of those things that change in people's sex lives as they get older?
By being able to work biologically?
Yeah, especially for men. About women, right, vaginal dryness. For men, erection problems. Yeah.
They get tired more easily.
Yeah, lower energy levels that could affect your sex drive in life, yeah. Lower sex drive in general. But not the way people think. People think you're not interested anymore in sex just because you're older. And that's not true. It's a pretty gradual change. Some people more than others, but generally most people still want to have sex, yeah.
Medications also.
Medication side effects are huge on sex, yeah. So you hit a lot of the key ones. Let's see. Menopause and andropause we'll talk about a little bit more. General decline in frequency of sexual activity, sexual dysfunctions like they call it dyspareunia, painful intercourse because of vaginal dryness or erectile dysfunction. Health problems for yourself and your partner can certainly affect your sex life. If your partner dies, obviously. But people do date and marry, remarry, have relationships. STIs occur in senior care facilities. Fewer partners is the problem, unless you're a lesbian woman or willing to, interested in having sex with other women. Your pool is small. So let's see, I think we have time to do this. Let's do a little, and I mentioned the need for touch at the beginning, especially among seniors. Let's do a little quick, so pair up with somebody you're willing to touch their hand. It's only hands, no undressing or anything. Okay, well here, all I want you to do, find a partner. This is not sex. These guys are already, they're having a seance back there, I think. So just index finger to index finger, like this, okay? Okay. No, not with yourself, with the other person. I'm demonstrating 2 hands here. So one finger from each person. Okay, here we got that. Now go ahead and put all your fingers touching like that. The whole hand. Okay. Now stop. Don't talk for a minute. Just think. Close your eyes. How does it feel? How does their hand feel? Is it warm? Is it cold? Is it smooth? Is it rough?
Cool.
Just think about how it feels. Now go ahead and put your palm together, flat, all the way flat if you haven't already. Things, and yeah, think about how your own hand feels in a sense, and then how the other person's hand feels. Okay, now we're going to get really crazy. Both hands at once. You guys aren't going to be able to do this. They're having a 3-way back there. So both hands, yeah. Okay, now again, close your eyes, don't talk, just notice how their hands feel. Okay, that's good. We can stop. So how did it feel? What did you notice about the other person's hands? Warm? I'm hearing a lot of warm. Anybody cold? 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 Mine are too. I'm feeling. What else? Yeah, what else do you notice? Really? Real warm? Yeah? Kind of damp? Yeah. But that, again, we all need touch, and it's such a wonderful thing, and it's not sexual, it's just, it's intimate. We all should, I think the way primates groom each other, right? They do that touching. It's functional, too. Yeah?
When we did our clinical for the CNA program, I noticed, well, we had much more time than the other CNAs working.
Uh-huh.
So I noticed that a lot of the residents just loved being touched. Back rubs, hand massages.
Oh, yeah, yeah.
And it was great because we had the extra time to do that.
That's great.
Unfortunately, not the CNAs and nurses don't have the time to give.
Yeah, that's sad, yeah.
So that's a problem.
So I think having, I don't know, volunteers or other people, again, and using lotion, of course, makes it a lot nicer and softer.
What is the meaning of STI?
Sexually transmitted infections. Oh. Sorry, I should have written it out. But yeah, I guess again, it's sort of denial that older people have sex with more than one person. That they can spread. There's no reason an older person couldn't get an infection. So specifically, what are some of the perimenopause is the period leading up. What does anybody know what the formal definition of menopause is? When are you done with your old, yeah?
A year after your last period.
Exactly. So a year with no period. So perimenopause is all the time leading up to that. We have sporadic periods and so on. So what are some of the things that happen during perimenopause to women's bodies?
Temperature change.
Yeah, hot flashes. Irregular periods. Yeah. Mood swing. What? I'm sorry.
Like irregular sleeping patterns.
Yeah, harder to sleep sometimes. Yeah, yeah. Mood swings. A couple people said. Yeah. Depression, common. Yeah, yeah. So all, and again, specifically vaginal dryness, vaginal atrophy, because what's happening is your estrogen and progesterone are dropping off pretty quickly, and they're the things that keep your skin nice, your hair nice, your vagina lubricated, and so these are just basic biological effects. So I think you mentioned osteoporosis, right? Brittle bones can be a problem, also estrogen related, and memory problems, not radical, but little changes. And of course what helps is just healthy lifestyle stuff, good diet, staying physically active, not smoking, limiting or not using drugs or alcohol. Of course, lubricant during sex or for sex, my wife and I have a 50-gallon drum. No, just kidding. Next to the bed. Let's just say she's been through menopause. Social support, the having friends or family around who make you happy and feel good. And then they used to recommend hormone replacement therapy, or estrogen, for like all women. When my mom was going through this, they were putting every woman on ERT. And then they found out it increased heart attacks and strokes and breast cancer risk. So they said now the thinking for most doctors is only do it as needed. If you're having debilitating hot flashes, not able to go to work and so on, then use it for the short term. But they were putting women on higher doses for long term, and it's just there are health risks associated with that. Yeah.
I had a question about that. Like, why does medicine feel the need to correct things that weren't issues in the past? Like, for example, vitamins is like one of them where like people grew up all their life without really needing vitamins unless they had like something that was really like they lacked something.
Right, right.
And then all of a sudden it comes out as like anybody can take it because they're all worried about it.
Right.
So.
Well, there are some good reasons for those changes, like people having more balanced diets maybe in the past, so they didn't need supplemental vitamins. And people died earlier, so sex among older people wasn't as big of a deal because people died when they were 60, and that was it, you know.
Now they're coming up with bioidentical hormones.
Yep.
From
soy.
natural source.
Yeah. So that they haven't fully researched the side effects yet, but probably less than artificial estrogen, for example. So again, okay if you really need it for as short, low dose and short a time as you need it to minimize health risks. What about for men? The andropause is what they call menopause for men. Not menopause, I've heard people say. So what changes with men in andropause? Moods? Yeah, so men get mood changes like women do, yeah.
Lower testosterone.
So lower testosterone is really the key thing that causes the other changes. What are some of the things that causes, do you know?
The testosterone will decrease.
But you know how that would affect a man?
It's lower sperm count.
So lower sperm production, not radically, but somewhat. Sex drives, big deal, declines.
Decrease libido, yeah.
Yeah, I'm sorry.
Decrease libido.
Libido. And gosh, all the things you see, less muscle mass, less hair. Yeah, it hasn't happened to me, but some people, I guess. Let's see. So after 30, men's testosterone starts declining by 1% per year. So I'm down a third now. So that's the difference, I think, is these changes are longer term for men, slower, more gradual than for women generally. Because for most women, menopause occurs within about a 5, maybe 10-year period. With men, you've got it going on for 40 years, 50 years, but it's gradual. Let's see, we talked about some of these. Erectile dysfunction can be a problem, sleep, memory, but a lot of the same things that women experience. Same things help too, healthy diet, physical activity, not smoking, limiting drug use, social support. Men have one thing women don't have, and that's Cialis, Viagra, the sildenafil, the things that cause or help facilitate erections. Women get blood flow to their genitals too. Women get erections. Your clitoris stands up a little bit, really. Your genitals fill with blood. That's just part of being aroused. And but there isn't a comparable thing. So they can't. You may have heard of Adye, or it's called the pink Viagra for women. Don't be fooled. It doesn't work at all. These facilitate blood flow. Adye is a psychoactive drug, and it has a terrible list of side effects. And the only benefit of women who they've tried it with, they had sex 1 time a month more. It was like 4 times instead of 3 or something like that. So it supposedly increases your sex drive, but not by very much. And again, it's not good for you as a medication. So there are other things women can do to deal with arousal issues, I think. And there is testosterone therapy, just like there's estrogen therapy for men. For women, this is for men. And it does work. It builds muscle mass. It increases libido or sex drive. It helps with erections and so on. So, but again, high risk, heart attack. That seems to be the main risk, cardiovascular stuff. That's me riding a gigantic wave. That's how I stay young, is surfing. But questions about either that male or female stuff? So here's the statistics. Half of people 60 or older are sexually active, Americans. The factors that facilitate it is if you had a high level of sex or even an average level of sex before you were older, you're likely to keep sexually active later. If you're in good physical health, if you have a partner or spouse available, and if you had sort of a varied sex life. I think what people have to realize is sex isn't just coitus or intercourse. It's hand jobs, it's oral sex, it's armpit sex. It's however you decide to have sex. It doesn't have to be traditional intercourse. And I think I have two friends, male friends, who are in their early 60s. They both quit having sex with their wives, and they're happily married. It's not marriage problems. I guess they've just both lost interest or let it go, and like, I don't ever want to be there. But I don't know what their sex lives were like before, but I know they were active. But if it can be difficult to have sexual intercourse if you've got back problems or a number of arthritis or certain things. But there's a lot of other ways to enjoy sex. And if not that, intimacy, massages, touching, non-sexual intimacy. So, but here you go, about 60% average between men and women, active in their 60s, 70s, drops down to about 40-some%, and then about a quarter of people in their 80s still having sex. I thought this was interesting. You got about half of men, a third of women masturbating after 70. Most men, most women, 80 to 102 fantasizing about sex, whether they're having it or not. And then single women, best sex is 66, and men 64. The big question is, what? You told that to a young person, they'd be, that's crazy, you know. Why? These are single people, 5,000 people surveyed who gave these numbers. Why? Why would those older ages be better? Yeah.
It could be experience.
Experience, definitely. Yeah. Yeah. What else?
Value just the emotional connection more so than the physical. They're not worrying about their bodies, and they're sort of at peace with themselves. Absolutely.
Comfortable, you don't care. You give up at some point worrying about, not give up completely, but your looks, it's like, really, I'm not trying to attract every person I meet, you know. And right, you relax about your body, and the intimacy, the closeness is more important than the performance of sex. And I think that's it for men and women. So that, just keep that in mind as you get older. So there are health benefits. This is for people of all ages, but it boosts your immune system, lowers your risk of heart attack and blood pressure. It's exercise, reduces pain because endorphins and other chemicals are released during orgasm. Lower risk of prostate cancer for men. So now if you men, you know, you're trying to convince a partner, hey, I don't want to get prostate cancer, we got to have sex. Right? Actually, you can masturbate, it has the same effect, but don't tell them. Let's see, improves sleep, relieves stress. It actually increases your, this is a use it or lose it thing. So don't quit. I mean, some people do quit for years and start when they find a right partner or something, but generally you don't want to stop. Like vaginal atrophy is not as bad if you keep sexually active. And bladder control for women is better, sexually active women. Yeah.
Why is that? Why
well, because contractions. Let's all, oh, I'm sorry. Go ahead.
The atrophy.
Loss of estrogen, it's just a physical reaction, yeah. You know, you've heard about Kegels probably, the tightening your pelvic floor muscles. You can do it right now. Men can do it too. Just, okay. And you hold it. It's like any exercise. And, I mean, this is a real thing. It helps with incontinence. I learned about this from my mother, who shared everything, and said that after she had children, when she coughed or sneezed, she would urinate a little bit. And the way to prevent that is doing Kegels after you give birth. And do it before you give birth too, because it helps with labor, and it helps with your sex life, helps keep your vagina in better shape. You don't lose bladder control as easily. And it's really just exercising those muscles like you might exercise any other part of your body. You don't need the barbells. They sell them that you can put, a ball end in your vagina and clamp down on it and hold it. You don't need to do that. Just pretend you're urinating and tighten up. My friend did this every time this was a woman who worked at Planned Parenthood like 30 years. She trained me on menopause and PMS. Every time she'd come to a stoplight, she would tighten up and hold it until the light changed and then go on. And she had a good vagina, I guess. I never found out. I don't know. But let's see. This guy, Delameter, found that old seniors who had sex regularly, both fewer medical or physical and mental health problems, and then better relationships, lower rates of depression. So another reason to stay active. So some specific things: diabetes lowers sex drive, and for men it can create erection problems. Of course, if you manage your diabetes, you can take hormones to boost sex drive, men or women, but it's sort of a last resort. And Viagra, of course, will help men with erection problems. For high blood pressure and vascular disease, can't take Viagra because it's a vasodilator, could cause problems. But papaverine is a drug you inject right into the penis. It sounds shocking. The men are all going, "Ugh." But it works really well. A friend of mine does it. A lot of insurance companies don't cover Viagra still. Some do, but his doesn't. So he uses papaverine, which is covered. I guess it's a lot less expensive. And he just gives himself a little shot in the penis before sex, and it really works. And it's very few side effects compared to the sildenafil-related drugs. And pump, you can buy, this is the Austin Powers method, right, with the pump, which he thought it made your penis bigger. It doesn't, but it can give you an erection. Sucking blood into your genitals can help cause arousal and erection for men. And then a penis ring or cock ring keeps the blood in so it doesn't flow back out and you lose your erection. So those are good with vascular-related illnesses. Arthritis, osteoporosis, any fragility, just different positions, adaptive equipment you can use, which I'll talk a little bit more about in a minute. Lung disease, breathing might be an issue, heavier breathing. So inhalers, of course, before sex. I just researched this recently. Fans help keep the air moving, and then you can actually wear oxygen during sex if you need it. And then BPH, benign prostatic hyperplasia, prostate enlargement. Almost every man is going to get this. I actually just read about a new treatment and put it on my Facebook page. TURP procedure, the transurethral resection of the prostate. It's actually surgery removing tissue. What happens is your urethra, a man's urethra, goes through his prostate, and when it enlarges, it pinches the urethra, so you can't urinate fully. So you have to go more often. My doctor, I just had my physical, he said, "How often do you have to get up and pee at night?" I'm like, twice maybe. And he goes, of course, I drink water when I get up, so that adds to it. But he said, that's okay. If it's more than like 3 times, you might, one might have to look at your prostate. The new procedure is, rather than the surgery, is to, they actually block some of the blood vessels that feed the prostate and kill the tissue that way rather than surgically. And it's a fairly new procedure, but it has promise and it's not invasive. It's an outpatient procedure. But it can be a problem when you have to urinate like all the time and can't sleep and so on. For any type of reproductive cancers, screening is so critical: mammograms, prostate exam, et cetera, breast exam. Medication, of course, for depending on the problem. Radiation therapy is still used, of course, and then surgery if needed. Incontinence, I mentioned Kegels, pads, and catheters if it's severe. Depression, being physically active, and medication, because all of these things can affect your sexual functioning. Side effects of medication, tell your doctor, don't just quit taking the meds, right? Which some people do, unfortunately. And you can ask for other medications. I mean, contraception can reduce sex drive, right? So hormonal contraception. So Tell your doctor, different pill, try a different pill. A lot of them have different formulas. And then sexually transmitted infections, condoms testing and treatment, of course. So getting into a little bit more depth on dementia, cognitive problems. So you know, there's Alzheimer's, Lewy body disease, and vascular dementia, the most common types. But other people, because I worked with people, you know, born with cognitive problems, it was lifelong, not just related to aging. But the biggest problem that I've seen is vulnerability to sexual abuse. They've done research. What percentage do you think of women who have dementia or cognitive disability enough that they can't communicate clearly what's happening are sexually abused?
80.
It's actually closer to 90, yeah. I've worked with so many women who've been sexually abused, who have cognitive disability. Screening the staff, of course, doing background checks. Don't put male staff with female clients, sad but true. Supervision, drop-in supervision. When you show up in the middle of the night, the boss shows up to make sure they're doing what they should be doing. And interviewing clients, if they're able to communicate what's happening, of course, is valuable. But yeah, really common. One of my friends, a guy who has severe CP, he was just raped, basically, a young man. So it's men and women, not just women. Loss of sexual desire. You can do, again, the non-sexual intimacy, the touch, the hugging. Let's see, increased desire can be an effect. Provide private opportunities. Those of you who work in a residential care facility, how many of them allow the residents to have sex? Do any of them not, specifically not? Because when I worked at Devereux, not allowed. And people had lived their whole lives there and were never allowed. The only place they could have sex was in the bushes or, you know, on the sly. And no wonder they did it in public, because they didn't have private places they could do it, yeah.
How do you know if they're allowed to or not?
Ask the manager or the boss, yeah, yeah. I mean, they probably would have told you if they're not. But then there's the issue of, do they have provisions to support it, like private opportunities? Is there any screening involved, especially if you have people with dementia? Well, I'll tell you, we came up with this 5 Ps of sex model to interview and sort of guide people who wanted to have sex. Do they have a private place or do it in private? Do they have permission of the person that their partner, the person they want to have sex with? Is it a peer, somebody close in age? We had a few men who were attracted to children, and so we had to say, you know, no, you got to be in your ballpark. They have to be adults, over 18, and then somewhat close in age to you. Are you using some kind of protections, particularly if you're able to get pregnant? And is it feel good? Is it a good thing? So just those simple screenings we would use to sort of ensure people weren't being abused and at high risk for a problem. Another thing that can happen is lowered inhibitions, right? You've seen people with Alzheimer's who don't follow the rules anymore, they don't know, might have sex in public or be naked in public. So just, you don't shame them, obviously, they don't know. You just say, oh, that's something you need to do in private, just like you would do with a little kid who you want to, they got their hand in their diaper at Kmart or whatever. There's really nothing better to do at Kmart, but no, I'm just kidding. You want to say that's something we do at home in private. You know, you don't need to make a big deal on it. And then infidelity. I don't know if you've seen this movie Away From Her. Has anybody seen that? It's about a woman with Alzheimer's. And she goes to a residential care facility, that's her husband. And they have this policy of no contact with the family for a month, which is crazy to me. But, because for one thing, she wasn't that out of touch. But she took up with another man there, and she basically forgot she was married or forgot about her husband because she didn't see him. And so it's all about kind of the husband dealing with her involvement with this other man. So that's kind of it's not traditional infidelity, but this other form. And you know, if somebody does have a partner, it's like, what do they call it in prisons? Conjugal visits, right? You want to have an opportunity where they can get together if they don't have their own home to go to on the site. So questions or comments? I'm going fast just because of time. comments? Yeah.
In every facility that I've been in, there hasn't been that opportunity of privacy.
Right. That's the biggest
It's not
problem.
built
Yeah.
on that.
Right. Yeah, when I was at Darrow, I mean, the staff would just barge into people's rooms and not even knock or anything. So, yeah, you're really on to an important thing. With physical disabilities, you've got finding a partner. There actually were surrogates. UCLA used to have a surrogate training program for people with physical disabilities. Aren't high priority partners for most people. Most people don't want a disabled partner. So it was real. I worked with so many men who couldn't find girlfriends, basically, because they had cognitive disability. But similarly for physically disabled people. So we need like a dating service for people with disability. Redefining sex as not just intercourse, but hand jobs. Again, all the range of sexual activity. Adaptive equipment, whether it's lifts or they have sex swings. There are ways to certain shaped pads and so on that can help facilitate sexual activity more comfortably. And then personal assistance. We don't have time, but I have a video showing a couple in their probably 60s with mostly physical disabilities being helped to have sexual contact by two staff. And they're trained in doing this, and they literally help the people get undressed, get in bed together, put their hands on each other. They put like cream on their hands and put their hands, and then they leave them alone to have some privacy and rub each other and so on. But I mean, where do you get that? I wish that was available in more places because people could use it. But it's really wonderful to see this couple. The woman has never had sex and views herself as like an old maid, she said. And it's so touching. And the men, they like benefited from it physically, from the physical activity of sexual contact. And then just some of the, you mentioned the privacy issue. Knock and wait. I mean, that's the rule we imposed. When I came to Devereux, we started. Client rights, we've talked about. Policy, ask what the policies are. What are there rules about sex? Are there opportunities? Erotica is the nice name for porn. Is that okay? I have a client I still see at Devereux, and every year he asks me to buy him a women's bathing suit calendar for Christmas. And I said, there are naked pictures of women available. And he goes, no, they should have bathing suits on. It's so cute. He's like 80, yeah. So, but he loves, I buy him that and a little bottle of lubricant. So he's happy as a clam. But let's see. Train the staff. I'm available. There are people at Planned Parenthood available. Of course, the more you know and the more comfortable you are with sexuality, the better. Non-sexual touch we've talked about. And then things like lubricant, vibrators. That's Jane Fonda with a vibrator. Let's see, erotica or sexually stimulating materials, condoms, and so on. Either the home should provide them or at least allow them, if not provide them. So I think that's, real quick, interviewing. Trust is so important to build first. Ask permission. Can I ask you some questions about sex? That empowers them to say, I'm not really comfortable. And you can say, well, maybe you can find one of these to ask that's okay with them. Don't assume heterosexuality. They might be gay, lesbian, bi, whatever. And then use pictures and models. They're much clearer than just talking. Do you have sexual, ask them about this. How do you address your sexual feelings if they have them? Are you having sex with others? What protection do you use? Has illness or medication had affected your sex life? Do you have anything that might be an STD or STI? This is a good general one. Any concerns, questions, or complaints that are sex related? And then this one's really important. Has anyone pressured you or forced you to have sex to get at abuse? And then what would help? That's just a nice open-ended question to ask. What could you use? They'll say a calendar and a thing of lube, right? If it's a man. So last, just support. Educate yourself and your clients. Be aware of your own sort of sensitive spots around this and what's okay for you, comfortable for you. Talk to them. Bring it up. We got to normalize sex and not make it the dirty secret that it is. It should be out there and talked about and no big deal. yeah, building your own comfort and other people's comfort. Working with family members. What was interesting when we started allowing people to have sex at Devereaux, we had a parent day every year. We thought, oh no, the parents are going to, it was only for adults, obviously. We thought the parents are going to freak out. We had the biggest turnout in this session I did on educating kids about sex and then allowing the adults to have opportunities. They were all in favor of it. They were so glad to hear their kid could have this normal part of their life happening. And I think that's lifelong, not just for younger people. And then provide whatever resources people might need. So I think that's it. Yeah. So I got to get out of here so you can do something else. But thank you for listening.